Welcome to the great paradox of our age, the loneliness epidemic. You have 1,000 friends at your fingertips. You're surrounded by co-workers in meetings all day. Your city pulses with millions. Yet you feel a hollowness behind your ribs. A whisper that says, no one truly sees you. This isn't imagination. The World Health Organization has declared loneliness a global health emergency, deadlier than obesity, as lethal as smoking 15 cigarettes a day. We're drowning in connection yet starving for meaning. Welcome to the loneliness paradox. You scroll through hundreds of friends. You work in open plan offices. You live in cities of millions. Yet, a hollow ache persists. You are not imagining it. Welcome to the great paradox of our age, the loneliness epidemic. The anatomy of loneliness. What is it? Solitude is peace. Loneliness is pain. Solitude nourishes. Loneliness devours. Psychologists define loneliness as the gap between the social connections you have and those you crave. It's your nervous system screaming, "Where is my tribe?" Types of loneliness. Emotional loneliness is the ache for one confidant who knows your shadows. Social loneliness is the despair of standing invisible in a crowd. But there's a third type. Existential loneliness, feeling adrift in a universe indifferent to your existence. This is where you can feel lonely even in a loving marriage. Neurological reality. When lonely, MRI scans show your brain's pain centers light up, identical to physical injury. Your body isn't being metaphorical, social rejection hurts. Evolution wired us this way. Exile from the tribe meant death. Why now? The perfect storm. The digital mirage. Discuss comparison, curated personas, shallow interactions replacing depth. Connection light. The digital mirage deepened. Instagram isn't connection, it's performance art. Every curated post trains your brain to hide imperfections. We've replaced vulnerability with vanity metrics. A generation fluent in images but illiterate in eye contact. Harvard studies confirm. Heavy social media users are 53% more likely to feel socially isolated. Urbanization and mobility. Loss of tight-knit communities, transient lives, anonymity of cities. Urbanization's hidden cost. Cities pack us like sardines yet fracture community. Your apartment building has 100 residents, how many could you to borrow sugar from? Pre-industrial villages had collective efficacy, shared childcare, grief, and harvests. Now, we outsource intimacy to Uber drivers and baristas. Work culture and decline of third places. Remote work pitfalls, the decline of communal spaces, such as churches, clubs, and pubs, and productivity obsession. Third places, where we need them, churches, pubs, community centers, these third places, beyond home/work, were relational safety nets. Since 1999, 44% of US third places have vanished. We traded stoop sitting for screen staring. No wonder loneliness spiked 300% in 20 years. The devastating cost. Physical health. New data. Loneliness is not just sadness, and it is a form of biological sabotage. Chronic loneliness increases cortisol, your stress hormone, by 30%, suppresses immunity, making vaccines 50% less effective. Accelerates cellular aging, making you biologically 7 years older than your calendar. Mental health epidemic. Loneliness rewires your brain for threat. The amygdala becomes hyper-alert, scanning every interaction for rejection. This creates a vicious cycle. Expecting dismissal, defensive behavior, actual rejection. It is not all in your head, it's in your neural pathways. Economic impact. Lonely employees take 5 extra sick days per year. US companies lose $406 billion annually to loneliness-induced burnout, sickness study. Isolation isn't personal, it's a systemic crisis. Psychodynamics. And the attachment science. Your childhood blueprint predicts loneliness. Anxious attackers smother. Avoidance build walls. Secure attackers. They emit social pheromonas, warmth that draws people inches. The good news. Attachment styles can be rewritten. The shame spiral. Loneliness metastasizes in silence because we stigmatize it. Admitting I'm lonely feels like confessing I'm unlovable. So we wear masks. I'm too busy for friends. Meanwhile, 60% of your co-workers feel the same. YouGov data. Trauma's shadow. Early abandonment teaches your nervous system. Connection equals danger. Your brain then sabotages relationships preemptively, rejecting others before they reject you. Healing requires rewiring this survival reflex. Solutions beyond. Socialize more. Forget networking events. Healing begins in micro moments. The 7-second grocery line smile that says I see you texting a friend. This song reminded me of you. Asking your barista, how's your day really going? These tiny ruptures of authenticity tell your brain, the tribe is still here. Vulnerability scaffolding. Start terrifyingly small. Share one unpolished feeling per day. That meeting left me anxious. This isn't oversharing, it's emotional pointillism. Each dot seems insignificant, but collectively they paint trust. Digital boundaries. Enable focus mode for 2 hours daily. Replace scrolling with voice notes and text messages, video calls and liking posts. Sending articles with your thoughts. Passive consumption. Quality of interaction trumps quantity. Therapy 2.0. Seek therapies targeting relational wounds. Interpersonal therapy. Repairs social bonds. Group therapy. Safe exposure to correctional experiences. Psychedelic assisted therapy. MDMA trials show an 80% reduction in loneliness. MAPS study quote, loneliness is not your failing. It is the collateral damage of a disconnected age. But here's your superpower. You're part of the species that built the Sistine Chapel and sent probes to Mars. We are wired for collective genius. Start today. Share this video with one person and say, this made me think of you. Sharing authentic feelings, even small ones, builds bridges. Start safe. Subscribe for more tools to help you rebuild a sense of belonging. You are not alone in feeling alone, and together, we'll reweave the fabric of connection. Therapy, CBT, is highly effective for loneliness rooted in patterns and trauma.